Thank you for joining us, our KSB's Learning to Live Well educational series. I'm Aaron Fox with KSB Community Wellness. Today's presentation is Home Remedies for Neck Pain, brought to you by Skyla Strum from our KSB Physical Therapy Department.
Hi, my name is Skyla Strum. I am a doctor of physical therapy at KSB Hospital in Dixon. I have been working at KSB for about 3 years as a physical therapist for a little over a year. I work primarily in outpatient physical therapy, so I see people with mostly orthopedic conditions, so some sort of pain or after a surgery, things like that, and then I do a little bit of other things. So one of the most common diagnoses that I treat is back pain and neck pain. And one of the most easy ways to treat neck pain is actually things that you can do at home. So today, that is what I'm going to go over. So in a study by the CDC, 14.3% of US adults reported neck pain. That's a huge number of people. And so that is kind of why I wanted to talk about this, because like I said, most of what we do as physical therapists isn't actually in the treatment room, it's what you do at home. The analogy that I like to use is if you're going on a diet. You don't go on a diet and eat 2 healthy meals a week and expect to lose weight. Or if you do, maybe you'll lose a pound here and there, but probably not much. But if you eat a healthy meal a day or 2 healthy meals a day, then you might lose more weight. And it's the same thing with physical therapy. We see people typically 2 times a week for about 4 to 6 weeks, and it's really what they're doing at home. So today I'm going to go over a few things that are easy for you to do at home. So one of the most common populations that neck pain affects is office workers, and the annual prevalence is 42.63%, or 42 to 63%, which is huge. So in a little while, I'm going to go over ergonomics, which is something that office workers can do to hopefully help reduce that incidence of neck pain. So first, I'm going to do a little bit of boring kind of overview of what pain is. So when we get an injury, if we sleep wrong or reach wrong or turn quickly to look over our shoulder when we're driving, we get that injury to our neck. Nociceptors or pain fibers are activated. These nociceptors travel from the site of the injury to the spinal cord and up to the brain. And then once they reach the brain, they are perceived as pain. So it's not immediately when the pain is perceived in the brain, it's not actually where the injury is. And then once they reach the brain, something called neurotransmitters are released, which causes an increase in motor activity and tonicity of muscles. And another word for tonicity or an increase in tonicity will result in muscle spasm. And then that muscle spasm leads to tissue damage, a decrease in blood flow, and oxygen. So there's something called the spasm pain cycle. And what this is there's pain, which causes spasm, and that spasm causes pain. So what I'd like to do is to teach you a couple ways to reduce that spasm and reduce that pain. So you can see in this picture that's kind of showing the same thing that I just talked about, where the pain signals are going up the spinal cord to the brain, and that's where they're perceived as pain. And it kind of breaks it down a little bit more anatomy-wise. So the first thing I'd like to talk about is thermotherapy or heat therapy. It's something that's very easy to do at home. It doesn't take very long, and it is very effective. So there's what are called thermoreceptors, and they initiate nerve signals that block that nociception or that pain in the spinal cord. So they kind of make it so that you get that nice warm feeling, so that your brain doesn't perceive the pain, instead it perceives that warming sensation. And heat decreases pain and spasm. So like I said, what we want to do is we want to break that pain, spasm, pain cycle. So in order to do that, we can apply heat. And so an easy way to do it is using a rice sock. which I will demonstrate in a little while and kind of go through how you can make your own at home. So if you think about it, if you're out where it's really cold and you're shivering and you just can't stop shivering, your muscles all spasmed up, once you go inside where it's nice and warm, your body just relaxes, you're not as tense, so that spasm decreases because you're in that heat. So it's the same thing when it's applied to a muscle. So you put the rice sock or a heating pad or any sort of heating modality, is what we call them, to the area, and that will hopefully reduce that pain and that spasm. Heat also increases metabolism or the healing process, so it'll kind of stimulate that, so it takes all of the bad things that are there from the injury and brings in good things, to make it simple. It also increases blood flow, which an increase in blood flow also brings in some, that heat kind of blood flow, blood is warm, and then also improves muscle extensibility, or that ability for that muscle to stretch or to lengthen, which are all things that we want. So some precautions with this: if you have diabetes, multiple sclerosis, peripheral vascular disease, a spinal cord injury, rheumatoid disease, or anything else that impacts your ability to perceive heat, or to kind of feel, if your area was burning, we obviously want you to be able to feel that. So please be careful if you're using heat if you have any one of these conditions. So rice socks are very easy to make. If you have a sock somewhere at home, preferably a tube sock that's a little bit longer, and with no synthetic materials, we don't want to start our microwave on fire. So what you're going to do is you're going to take the sock, and what you can do is you can take it and put it over a tall glass so that it's a little bit easier to pour the rice in so you don't make a mess all over the floor. And then you're going to fill the sock up with rice, tie the top of the sock, and then stick the rice sock in the microwave for 1 to 2 minutes until it reaches that point in time where it's about the right temperature. You don't want it to be too warm and you don't want it to be too cold. So it might take a couple of times for you to figure out what's best. All microwaves kind of vary in how hot they get, so it might take you, a few times to figure out that right time area. But then once you have that, find the area that hurts the most and stick it there. Leave it there for 10, 15 minutes, up to 20 minutes. It's really easy to do when you're rewinding at the end of the day and just kind of relaxing, watching TV. Stick it on your neck. Make sure you have nice, good posture. Stick it on your neck, leave it there, and just let it work. And when you're doing that, you will likely start to feel your body relaxing. And another thing is you don't want to be tense. You don't want to bring your shoulders up. We want to just relax when we're having the heat, when we have the heat on there. And like I said before, please make sure that you're watching the area and making sure that you aren't getting burnt. We don't want anybody to end up with burns. I've had a couple of patients come in and they say, oh, well, I fell asleep on the heating pad and I got burnt. We don't want that. So please make sure that you set a timer so that you're not on it too long if you do fall asleep, because like I said, it promotes relaxation. So we don't want you to fall asleep and get burnt. And I will kind of demonstrate a little bit later areas that you can put the rice sock. So I looked up manual therapy versus stretching. One of the things that we do as physical therapists typically for people with neck pain is massage. And there are other things, manual therapies that we can do, but one of the biggest is massage. And everybody knows, like, oh, can you just rub my neck a little bit? Oh, honey, can you rub my neck? Different things like that. I know when I come home from school, when I was in school and I would come home, my mom would say, oh, can you just, there's one spot right here, can you get that? So massage is obviously one of the things that we would do if you were to come into us. And so I wanted to look up, is that more beneficial than stretching? And so there was a study with 125 women with what's called non-specific neck pain, or that's neck pain that isn't because of any sort of traumatic injury. There's no fracture, there's no bulging disc, anything like that. It's just non-specific neck pain. And so there was 2 groups. The first, and they actually switched halfway through. So the first group was manual therapy 2 times a week for 4 weeks, which is a typical course of physical therapy. And this included what's called low velocity cervical joint mobilizations, or taking the joint and slowly moving it so that it increases that movement in the joints themselves. So not necessarily the muscles, but more working on the joints. And then traditional massage, what you would think if you went to a massage therapist or anything like that. And then passive stretching, or stretching that's done not by you, but by somebody else. And then the second group did active stretches. They did stretches for the upper trapezius, the scalenes, and then cervical neck extensors. And they held those 3 times for 30 seconds. And then they also did what's called a chin tuck, or giving yourself a double chin. This is the exercise that people hate, because who wants to give themselves a double chin? But that's what it is. You take your chin and you bring it back. And they did those 5 times with a 3 to 5 second hold. And like I said, after those 4 weeks, they switched and they did the opposite treatment. And the results for both groups, there was a significant reduction in stiffness, numbness, headache, and impairment in work and leisure time physical activities. And then they broke it down, and they did say that group 1 decreased by 52% and group 2 only by 39%. So there was a little bit more of an increase or decrease in pain with the group that had the formal therapy, but still a significant decrease in the group that was only stretching at home. So that is pretty significant. So now I'd like to go over a few stretches with you. So the first one is going to be for the upper trapezius. So this muscle is right along the neck, so it kind of comes down here. So what you're going to do is you're either going to bring your arm behind you, or if you're sitting in the chair, you can see in the picture that I have here that they're sitting on their hand, or you can grab the edge of the chair. Either one works. And then whichever side is bothering you, which we're actually going to do both. It doesn't hurt to do both sides. Some people have pain on both sides, some people only have pain on one side, but it's very likely that if you've got some tightness on one side, you probably have some sort of tightness on the other side. So once your shoulder is stabilized, either behind your back or under a chair, you're going to lean your head directly to the side. And you should feel a good stretch right through this muscle here. And when you're doing stretches, we don't want pain. We don't want it to be a painful stretch. We want it to be a comfortable stretch. If you are getting any sort of increase in pain, stop or kind of bring your head up to where you can still feel a comfortable stretch, but you're not getting that pain. And then if you feel like you need a little bit more, you can add a gentle pull with the opposite hand. And then just like in that study, you're going to hold 2 to 3 times for 30 seconds each. And then we'll switch to the other side. And I'm going to kind of pull just a little bit, but you don't necessarily need to. And make sure that this shoulder doesn't come up. We don't want it to raise. That's the purpose of kind of anchoring it down. You're just going to hold it for about 30 seconds. And you might feel it a little bit more on one side than the other, and that's okay. All right. And then for the next exercise, or next stretch, it's called the levator scapulae, or levator scap is what we commonly refer to it as. And that muscle is more along the back of the neck. Typically, that's where a lot of people have knots. So for this one, same thing. Arm behind your back, hand under your thigh, or hand reaching under the chair. And so if we're going to stretch the right side, we are going to bring our nose down to your armpit. So you're going to act like you're sniffing your armpit, and you can change the angle of your nose to feel it in a little bit of a different spot. And you want to go right where you feel it. Good stretch, no pain. And again, if you feel like you need a little bit more of a stretch, you can pull. And when you're doing these, you want to be as relaxed as possible. So probably better to be sitting in a chair to help with that relaxation. But if you're at work or somewhere that you can't sit, standing is fine too. And then we're going to switch to the other side. So just getting that good stretch. And holding it for the 30 seconds. Most people, if they had to guess 30 seconds, are really bad at guessing 30 seconds, so not a bad idea to grab a kitchen timer or your phone and bring that out so that you hold it for that true 30 seconds. And then we're gonna go talk about posture. Posture is something that I have noticed is terrible in most of us. So I'm sure that everybody's heard somebody at some point say, sit up straight, why are you slouching? And that contributes a lot to neck pain. It puts increased tension on those muscles and other structures in the neck and back. So we want you to sit up nice and tall. To the right, there is a picture of what's called a plumb line, or just a straight line that goes down the side of the body. And with that line, your ear, so the middle part of your ear should line up with the outside of your shoulder, which should also line up with your hip joint, through the knee, and then through that bump on the outside of your ankle. And that is what is considered ideal posture. Now, we don't all fall in that category, but the goal is to be as close to that line as possible. So bringing your shoulders back, doing those chin tucks, even though you don't want to give yourself a double chin, working on that, just bringing the head straight back and trying to get yourself in a good alignment. And then, so this one is of standing, and on the next slide I have a picture of somebody sitting, so we'll go over that as well. And approximately 60% of people with neck pain are reported to have what's called forward head posture, or that head sticks forward. Another common thing is rounded shoulders. So we want to bring our shoulders back and bring our head back. That continuous forward head posture increases the load on the posterior, or the structures in the back of the neck, including bones, ligaments, joint capsules, and muscles. So we talked a little bit about muscles and a little bit about the bones themselves with those mobilizations. And then in a study by Yep, he looked at people with neck pain, and there was revealed to, again, be a significant forward head posture when compared to some people without neck pain. So the more forward their head is, the more likely they were to have neck pain. And it was suggested that 10 to 15% of the level of pain and disability was attributed to their neck posture. So that's huge. If we can just work on sitting up a little bit taller, what I usually tell my patients is it's very hard to go from having poor posture to having perfect posture in a day. But if you do it slowly over time, it gets a little bit easier. So if you're watching TV, I know a lot of TV shows don't have commercial breaks anymore, but if you're watching something that still does have commercials, or you don't want to pay for the commercial breaks, or the commercials to be out of there, do it during a commercial break and see how long you can hold it for. Or set a little timer on your phone that goes off and says, hey, I need to sit up straight. And sit up straight for as long as you can. And you're likely going to do something that you forget about your posture, and you're going to go back into that slumped forward head, rounded shoulders posture. But the more you do that, hopefully the longer you're able to maintain that proper posture and reduce the stress on those muscles, and the muscles, ligaments, bones in the back. So try and work on that, and listen to me. All my patients come in, they say, oh, I heard you in my head telling me to sit up straight. I was sitting at home working on the computer, and I heard you say, sit up straight, why are you slouching? So that's a very common thing for people to come in and say. So maybe you'll hear me next time you're sitting at the couch watching TV saying, sit up straight. But it really does make a big difference in how people feel. And they will tell you that too. You know, I noticed that I was not sitting up straight, and I sat up straight, and my neck felt better. So try it out. If it doesn't work, that's all right, but give it a good try. And then ergonomics. So ergonomics is fitting the job to the person. So most of the time, companies are very focused on, okay, I just need somebody to do this. And it doesn't really matter how it looks for that person compared to the other person. So they might have somebody that's really short take over a job that was for somebody that was really tall, and that's not great. That's not ideal. So ergonomics is the part of fitting that job to the person, or adapting that workstation so that it fits and it doesn't cause those increases in stress. So this is a picture actually by OSHA. that is going over the proper way to have your desk set up. So the top of the monitor should be level with your eyes or just below eye level. So you can see that in the picture, it's circled at the top of the monitor. It's pretty much level with her eyes. And then your head and neck are balanced and in line with your torso. So again, if we think of that plumb line, you can see it's going through their ear, through the shoulder, and then you can also see it's up right around the same level as their hips. And then their shoulders are nice and relaxed. So like I said earlier, we live in a very stressful situation right now, and most people tend to, they hold their stress in their shoulders. I'm sure you've heard somebody say that. So we want to really get in a nice relaxed position. We don't want the armrests up too high where our shoulders are constantly at a shortened position. We want that upper trap and that levator scapulae, we want that to be at a nice relaxed position. We don't want to cause any increase in that muscle tonicity. We want to decrease that. So shoulders nice and relaxed with your elbows supported, that'll help. And make sure that those are at a good level. You're not reaching super low or having to reach up. And then your wrists and hands should be in line with your forearms. So you can see here, she's got her elbow nice and on the elbow rest. And then she's got a little pad that goes next to the keyboard to keep her wrists up, so that her wrist level, so that they're not cocked up. And there's also ones that they make for the mouse that go right so that your wrist rests nicely on that little pad so that you're all in line. And then there should be adequate room for your mouse and your keyboard. You don't want to be reaching for your keyboard or have to be hunched over because there's nowhere for your keyboard to go. We want it to be at a nice level where this person's is. So if she needed to put her keyboard away, she could tuck it away so that she could work nicely at her desk itself. So this setup is very nice, and she's also got her little back supported with a lumbar support. So most nicer office chairs will have some sort of lumbar support that you can use, whether it's a little knob that you have to change, or if it's one that's already there and you can't make changes to it, that's okay too. You can also, if your chair doesn't have that, you can put a little pillow or a blanket, something there to give yourself a nice lumbar support. It should have a little bit of a curve because that's how our spine is shaped. It's shaped with a curve, so we want to keep that there. And then feet flat on the floor. So sometimes the desks aren't able to be adjusted, so you might have to adapt something where your feet are up on a platform or something like that, but we don't want our feet dangling. We don't want our knees all the way up either. We want our feet nicely resting on the floor. So like I said, this picture is a very good demonstration. So if you're able to kind of bring this in and kind of look at your workstation, how is it set up for you? Have somebody take a picture of you when you're sitting at your desk and say, is my computer at the right level? Am I relaxed or am I tense? Is there something I can do to make this workstation fit me? And most bigger companies will have somebody that if you say, hey, I've been having a lot of neck pain, I think that my desk isn't set up right, is there somebody that can come in and look? Most of the time, companies will be willing to do that because they don't want you hurting. They want you working at your best. And if you're, oh man, my neck hurts, and you have to stop a bunch of times to stretch out your neck or bring your shoulders back, we want you to be comfortable where you work. So I gave you a bunch of different ways to kind of help this pain at home. And then there's physical therapy. So obviously, if these things aren't working, I want you to come see me or come see one of my coworkers. We will find what is causing your pain, and we will work with you to help you develop the best way to reduce your pain. So we at KSB, we offer physical therapy, occupational therapy, speech therapy, and audiology. And I think in a couple of weeks, there's actually going to be a presentation that kind of goes over a little bit more about that. So if you continue to suffer from neck pain or anything else that's impairing you, please contact us. You might have to reach out to your doctor first, but we want you to get better. We don't want people sitting in pain. And a lot of times, I just had somebody today that said, I wish I would have done this sooner. I wish I would have came in sooner, because now it's to the point where it's not tolerable anymore. I've gotten to the point that I had to reach out, and we don't want that. So try these few things for a week or two, and if it's still not getting any better, then talk to your doctor. Don't let it go on and just say, oh, well, I just slept wrong. We don't want that. We want you to be pain-free, or as pain-free as possible. And then I put this diagram in here, so hashtag #ChoosePT is the kind of slogan that they're using now. We don't want you having to rely on pain medications or anything like that. So choose physical therapy. We'll help you. We'll address your goals and look at how things are working for you and figure out ways to make that better. And here are my references. Thank you very much for listening.
Thank you, Skyla, for that great presentation on neck pain. So hopefully that was helpful to everybody. If you have any questions, comments, please put below. And then we look forward to you joining us for future programs. Thank you.